Hello everyone. Are you one of them that had experience in losing a loved one or getting fired from a job, or it can be you are in the situation that going through a divorce in a relationship and others a difficult situation that can lead your feel sad and down at the same time? That what we call it depression and anxiety. Do you know that in the case of individual who are diagnosed with the depression is known as a psychiatric disorder? The main expectation of the low mode is much more severe and mostly people will persist about it.
Hello everyone, do you know what is the meaning of depression and anxiety disorders? So, depression and anxiety disorders not the same. Depression and anxiety disorders are different, but people with depression often experience symptoms similar to those of anxiety disorders, such as nervousness, irritability, and problems sleeping and concentrating. But each disorder has its own causes and its own emotional and behavioral symptoms. Many people who develop depression have a history of an anxiety disorder earlier in life. There is no evidence one disorder causes the other, but there is clear evidence that many people suffer from both disorders.
Hi, Assalamualaikum. So my name is Nabil. So today I'm going to talk about purpose of study for anxiety and depression. So what is depression? Depression is a leading cause of disability in the world. Depression, also known as a major depression disorder, is a common illness that causes a present feeling of sadness. All ages, ethics, and socio-medical groups are vulnerable to depression, and it is very high personal, social, and economic cost. Depression is also a major cause of death, particularly in young people to suicides and others. So, finding effective depression treatment can take a long time. There are many treatments available that have proven to be effective in a research study involving the large group of people. For each individual, however, the first treatment tried the effective less than half of time. People with depression often have to try multiple treatment to find one that works, which can be a long time consuming and disheartening process. To add to this challenging, the risk have relapse for the depression is high and it's going to take a long time. So depression biomarker have the potential to transform depression care. That's all for me. Thank you.
Okay, hi. So now I will explain about how to handle anxiety and depression. So, first of all, you can handle anxiety and depression by doing some exercises. Take about 15 to 30 minutes brisk walk every day, or dance, jog, or even cycling if you prefer. People who are depressed may not feel much like being active, but make yourself do it anyway. Ask a friend to exercise with you if you need to be motivated. And then once you get in the exercise habit, it won't take long to notice a difference in your mood. In addition to getting aerobic exercise, some yoga poses can help relieve feelings of depressions. And try downward facing dog or legs up the wall pose. Two other aspects of yoga, breathing exercises, and meditation can also help people with depression feel better. So next, nurture yourself with good nutrition. Depression can affect appetite. One person may not feel like eating at all, but another might overeat. If depression has affected your eating, you'll need to be extra mindful of getting the right nourishment. Proper nutrition can influence a person's mood and energy. So eat plenty of fruits and vegetables and get regular meals. Um, Even if you don't feel hungry, try to eat something light like a piece of fruit to keep you going. And then moving on to the third one, which is you should identify troubles, but don't dwell on them. Try to identify any situations that have contributed on your depression. When you know what's got you feeling blue and why, talk about it with a caring friend. Talking is a way to release the feelings and to receive some understanding. Once you air out these thoughts and feelings, you turn your attention to something positive. Take action to solve problems, ask for help if you need it. Feeling connected to friends and family can help relieve depression. It may also help them feel there's something they can do instead of just watching you hurt. And then the next one is you need to express yourself. With depression, a person's creativity and sense of fun may seem blocked. Exercise your imagination, do something like painting, drawing, doodling, sewing, writing, dancing, composing music, or anything, and you not only get those creative juices flowing, you also loosen up some positive emotions. Take time to play with a friend or a pet, or do something fun with yourself. Find something to laugh about, a funny movie perhaps. Laughter helps lighten your mood. And then the last one, try to notice good things. Depression affects a person's thought, making everything seem dismal, negative, and hopeless. If depression has you noticing only the negative, make an effort to notice the good things and try to notice one thing. Then try to think of one more. Consider your strength, gifts, or blessings. Most of all, don't forget to be patient with yourself because depression takes time to heal. And that's all from me. Thank you.
So this is the symptom of anxiety and depression. So the first symptom is excessive worrying. If you find yourself constantly worrying about the things, it could be a symptom of anxiety. While some worry is a normal part of everyday life, people suffering from anxiety deal with excessive worry even about the thing that might not otherwise seem very important. So the second symptom is feeling restless or on edges. Feeling of unexplained restlessness and tension can be another common symptom of anxiety. This can include a sense of impending doom or disaster, sometimes accompanied by fear or even panic. So the third one is muscle tension. Muscle tension is a physical symptom that often accompanies mental health issue, including anxiety. So this constant tension leaves you feeling sore and physically exhausted even when you haven't done any other physical activity. So the fourth is feeling of worthlessness. People suffering from depression often experience a persistent feeling of worthlessness and low self-esteem. This can be a more general feeling or can be related to a specific area such as work, school, or personal relationships. So the fifth one is withdrawing from family and friend. If you find yourself withdrawing from relationship with friend and family, you could be suffering from depression. People with depression often remove themselves from otherwise happy, healthy relationship and struggle to form new connection with others. So last but not least, reckless behavior. Depression can often manifest itself in reckless behavior, including drug and alcohol abuse and unsafe sex. This can also include risk-taking activities like reckless driving or getting into physical conflict. That's all from me.
Okay, so there are a certain numbers of factors that can cause depression in people. And first is abuse. Any physical, emotional, or sexual abuse can also increase the risk of depression. And this include any substance abuse such as alcohol and drugs. And second is certain medications. Drugs such as isotretinoin and corticosteroids, often prescribed by doctors to their patients, may also increase the risk of depression. And then third is death or loss. Sadness and grief caused by the death of loved ones may also cause depression, as we all know. And then conflicts with any family members or friends may also increase the risk of depression. And next is the genetics. A family of depression history may also increase the chance of someone to develop depression in life. And then major events, whether it's a good or bad one, such as starting a new job, getting married, or graduating, may also increase depression. And next is anxiety. Anxiety is often caused by people who are perfectionists in life and then who have lack of self-esteem. And then physical health problems may also cause anxiety.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Syahir bin Ahmad Halil. I'm from BHM. So basically, our group chose the topic of depression and anxiety. So what we expected, the outcome of the program is that we want to increase the awareness of those people, or basically to let them know that there are many organizations and NGOs that can help them to overcome the problem or the issues. We also want to increase the awareness of these people that they are not alone. Those who having the depression or anxiety, that they are not alone. There are a lot of organizations to help them, and this is important to let them know that they are not alone to throughout the problem. This is important that because of those people who having the depression or anxiety issues are basically thinking that they are on their self. There are no people around them to help. So that this is important to reduce the bad and negative.
Hi, so I'm going to explain about the types of anxiety and disorder. First, I'm going to explain about anxiety. The first anxiety is basically generalized anxiety disorder. So generalized anxiety disorder, which is GAD, is an anxiety disorder characterized by chronic anxiety, exaggerated worry, and tension, even when there is little or nothing to provoke it. And the second one is most commonly in people, which is obsessive compulsive disorder, which is OCD. So OCD is an anxiety disorder, and is characterized by recurrent unwanted thoughts, like obsessions, or repetitive behavior, which is compulsions. So repetitive behaviors such as hand washing, counting, checking, or cleaning are often performed with the hope of preventing obsessive thoughts or making them go away. So performing these so-called rituals, however, provides only temporary reliefs, and not performing them markedly increase anxiety. So the third one is panic disorder. So panic disorder is an anxiety disorder and is characterized by unexpected and repeated episodes of intense fear, accompanied by physical symptoms that may include chest pain, heart palpitations, shortness of breath, dizziness, and abdominal distress. And the fourth one is basically post-traumatic stress disorder, which is PTSD. So PTSD is an anxiety disorder that can develop after exposure to a terrifying event or ordeal in which grave physical harm occurred or was threatened. Traumatic events that may trigger PTSD include violent personal assault, natural or human-caused disasters, accident, or military combats, as for example, the army. people in the army. Fifth one is basically social phobia or social anxiety disorder. Social phobia is an anxiety disorder characterized by overwhelming anxiety and excessive self-consciousness in everyday social situations. So social phobia can be limited to only one type of situation, which is fear of speaking in formal or informal situations, or eating or drinking in front of others, for example. And it is the most severe form, and maybe so broad that a person's experience symptoms almost anytime they are around other people. So that is all for anxiety, and I'm going to explain about depression. So the first depression is major depression. You may hear your doctor or a doctor call this major depression, depressive disorder. You might have this type if you feel depressed all the time or most of the days of the week. So that is major depression. The second one is persistent depressive disorder. If you have this depression that lasts for 2 years or longer, it's called persistent depressive disorder. This term is used to describe two conditions previously known as dysthymia, which is a low-grade persistent depression, and chronic major depression. And the third one is very common. It's bipolar disorder. Someone with bipolar disorder, which is also sometimes called manic depression, has mood episodes that range from extremes or high energy with an up mood to low depressive period. And the fourth one is seasonal affective disorder, which is SAD. So SAD is a period of major depression that most often happens during the winter months when the days grow short and you get less and less sunlight. Its typical goes away after spring and summer. The fifth one is psychotic depression. So people with psychotic depression have the symptoms of major depression along with psychotic symptoms such as hallucination, delusions, and also paranoia. The sixth one is peripartum or postpartum depression. This is most common in women because women who have major depression in weeks and months after childbirth may have postpartum depression. So and the last one for depression is premenstrual dysphoric disorder or PMDD. So women with PMDD have depression and other symptoms at the start of the period. So that is all for the types of anxiety and disorder.